Welcome back to Fast Money. Exact Sciences shares popping after the company announced positive trial results for its next-gen colorectal cancer test. The company's new Cologuard screening technology successfully detected cancer in 94% of test subjects and had 30% fewer false positive results compared to a previous offering. Joining us to break down the results is Exact Sciences CEO Kevin Conroy. Kevin, great to have you with us.
Melissa, thanks for having us. It's so great to be on your show.
You sound like a happy man. Analysts were looking for 89 plus, 90 plus in terms of improving that rate. You got to 94%. What does this mean for patients?
It's a home run for patients. And let me provide a little context. Colon cancer is #2 deadliest cancer. And the challenge is not enough people are getting screened. Screening saves lives. We know it. And 60 million people, about half of the people who are recommended for screening, aren't up to date with their screening. Cologuard revolutionized colon cancer screening. About 10 million people have been screened with Cologuard to date. And now what we call next generation Cologuard, these results show a significant step up in performance in terms of detecting cancer and in terms of lowering the false positive rate.
Help us understand the market at this point. There are a number of people who might have gotten false positives. Those tests are good for 10 years. So those people have been screened. They won't be taking another test for 10 years. So how can we think about this market and who will actually use this test?
Yeah, first of all, the data from the study showed that this next generation version of Cologuard detects 94% of cancers. Putting that in context, the main guideline group says that colonoscopy detects 95%. So they're awfully close. In terms of the false positive rate of Cologuard, it was 13%. And now these new data show that it's only 9%. That's a 30% decrease, meaning 30% fewer people need to go unnecessarily to a colonoscopy, meaning they can avoid a colonoscopy and stick with Cologuard. So everybody wins. The other important thing about this study is it showed our test's ability to detect 75% of the most advanced precancers. And these are precancers that are maybe 1 to 3 years away from turning into stage 1 cancer. By finding them, removing them, that's addressing the problem early.
I wanted to ask you about screening for advanced adenoma. I know analysts were saying that this would be secondary to colorectal cancer, but what are your findings there? And could that be a reason for the Cologuard 2.0 test eventually?
Yes, Melissa, it's a really important part of screening is to find precancerous polyps, especially the advanced ones, and importantly, stage 1 and stage 2 cancers, which are the ones that are the most treatable. So stage 1 patients, 98 out of 100 people survive 5 years. Stage 4 colon cancer, 8 out of 100 people survive 5 years. So earlier detection is everything. There's no therapy as effective as earlier detection, and now non-invasive screening in your home with Cologuard and this next generation version. We're just thrilled.
And you have an investor day tomorrow, as I understand it. So thank you, Kevin. We appreciate your time.
Thank you, Melissa. We can't wait for the investor day tomorrow.
All right, CEO of Exact Sciences. That stock is up 6% right now and climbing in the after-hour session. Up next, your final trades.